Hey folks, Dr. Matt Symons from Palm Beach Health Center, and I'm here to talk to you about my condition of the week, and the condition of the week is carpal tunnel syndrome. So a lot of you know about carpal tunnel syndrome. It's pain that goes in the wrist, oftentimes down into the fingers, and it can sometimes be a burning or an electrical pain that goes down into your wrist as well. Oftentimes, carpal tunnel syndrome is just misdiagnosed and mistreated. So when people have wrist pain and hand pain, if they're diagnosed with carpal tunnel, oftentimes what they'll do is they'll cut out some of the tendons or open up that space there and also to allow for the tendons to have more room in their wrist. The problem with this is it doesn't address the whole problem. You see, in about 80% of cases, carpal tunnel is known as a double crush syndrome. And what that means is that the nerves are pinched in more than one place, so at least two or more. So the second place that it could be pinched would be either elbow and wrist, or shoulder and wrist, or very commonly, neck and wrist. Or any combination of those joints on the way down. So if that nerve is pinched in more than one place, it's like having a garden hose that's being pinched in more than one place. If you only unkink one of those problems, then you're still leaving one of the problems behind. So the first thing that we would do in our office is take a look at the entire chain of where those nerves are going and where they're affected. And then the second thing we would do is make sure that if there's any kind of muscular imbalances, that we're dealing with those first. There's very effective ways of using laser therapy, of using exercises to open up those nerve pathways so that you don't necessarily need surgery. And the next thing we would say is if the carpal bones are misaligned, if there are, at some point there was a trauma, there was a fall, or some kind of, repetitive task injury that moved one of the carpal bones out of place, it's very, very easy to realign that joint. So some of my patients who've been told they need carpal tunnel surgery syndrome are so relieved and surprised when all they needed was a couple of joint adjustments to their wrist, and it was simple, it was safe, it was effective, and it saved them a lot of pain, money, aggravation that they would have had if they had gone through the surgery, which wouldn't have fixed the whole cause of the problem anyway. So think about this. If you or someone you know is suffering from carpal tunnel syndrome, there might be a better solution than just having more drugs and more surgeries. There might be a safe, effective chiropractic technique to take care of the cause of the problem. So if you know somebody who's dealing with carpal tunnel syndrome, make sure you share this with them so that together we can help them out. And this has been Dr. Matt Symons from Palm Beach Health Center giving you a high five.